welcome to the January 2023 DSS Board meeting. Can you believe it? Happy New Year, everyone. I'd like to call this meeting to order. And before we get started, observe a moment of silent prayer or silent meditation. Okay, do we have any public comments? Okay. All right, do we need a motion to adopt or revise? Do we need to revise? Put anything into the agenda today that's not on here already?
Yes, Madam Chair, after the recognition of the new hires and retirees, we need items for consent.
Okay, so I need a motion to revise today's agenda.
So moved.
Second.
All in favor?
Aye.
Aye.
Okay, thank you. And we need to have a motion to approve the previous meeting's minutes from December.
So moved.
Second.
All in favor?
Aye.
Okay, thank you. All righty, I'll turn it over to Director Rochelle to look at, to tell us about the new hires and retirees.
So what I'd like to do is, I'd like to recognize the new hires, and as I call your name, if you could please step forward to the podium, introduce yourself, and just tell us a little bit about yourself so that we get to know you. So the first person would be Alexis Studley. Welcome, Alexis.
Welcome.
Good evening, everyone. I'm Alexis Dudley. Hey, how you doing? I came from ECU Help. I've been there for the past 7 years. I decided to step out on faith and try something different. So here I am with DSS. So I'm hoping for a great experience.
Welcome.
Thank you.
Thank you.
Thank you.
Plan to stay a long time.
Absolutely. Elizabeth Dahl? Dale. And do you like to be called Elizabeth? That's fine. Okay. Welcome, Elizabeth.
Thank you. Good afternoon. My name is Elizabeth. I am coming from 6 years of detention work in Martin County, well, Bertie Martin. And I'm trying something new, so here I am.
Well, congratulations.
All right.
Thank
Welcome.
you.
And Christina Purvis?
Good afternoon, everyone. It's nice to meet you all. I'm Christina Purvis. I have a bachelor's degree in psychology. So social work, dealing with people has been a passion of mine for years, and I'm excited to work for Pitt County.
Welcome. We're glad you're here.
Thank you.
What,
department is she in?
What area?
A unit
What's
or
your
whatever
focus?
it's called?
My focus, I'm an income maintenance caseworker.
Okay.
One.
Right.
Thank you.
Appreciate it.
Thank you.
Okay, we will move on then to items for consent. Ms. Rochelle will tell us about those. We'll need a motion for those.
So we have a grant from Greenville Utilities Commission, their Neighbor to Neighbor program, in the amount of $28,800.
Okay, any discussion, any questions, Ms. Rochelle? Can I have a motion, please?
Madam Chair, I'd like to make a motion that we approve the report.
Okay.
Second.
All in favor?
Aye.
Okay, motion passed. Okay, we have items for report with Mr. Averett.
Good afternoon.
Good afternoon.
I'll start with the Medicaid and Food and Nutrition Services programs. Our Medicaid report card for December, the medical assistance for the disabled category of Medicaid, we passed the report card at 92% for the month of December. 90% is required to pass. And we also scored 92% in the area of all other Medicaid programs. So staff did well in meeting the deadlines for the Medicaid programs for the month of December. To update on the Food and Nutrition Services Program, as of today, we have 579 FNS applications pending. Of those 579, there are only 3 applications pending which exceed the 30 days processing time standard. So thank you to the staff for that success, the program managers, supervisors, and workers. We have come to 579 pending with only 3 beyond 30 days, from a figure of over 1,300 in September that we had pending at September. So we've come a long way with that. And I'd also like to share the staffing in filling our vacancies in the Food and Nutrition Services section. We have 3 employees coming in as income maintenance caseworkers on January 23rd. We will have 5 coming in early part of February. So that's 8 positions that are being filled in Food and Nutrition Services. Of the 8, 4 have prior Food and Nutrition Services experience, which will be very, very helpful to our meeting our processing goals, which the state requires. And also, we will begin working with the other 4 and training them in Food and Nutrition Services policy. The LEAP program began December 1st. Pitt County's allocation for 2022-2023 is $1,511,751. And we have approved, as of December 31st, $574,300. Now, this includes the automated payments to individuals age 60 and over. We had 1,536 households that are receiving in that category that are age 60 and over that will receive an automated payment. The automated payments will be issued during the month of January. We don't have an exact date, but the notices have already gone out to households, giving them the amount they will receive. The state has sent those notices out, and sometime in January, the payment will be made to the utility provider. I would like to point out that because the Low-Income Energy Assistance Program is not an emergency program, if individuals have or households have needs with disconnection of service, the SIP program or Crisis Intervention Program is the emergency assistance program they can ask for assistance through while they're waiting, if they're still waiting on their LEAP payment and are facing disconnection. We refer clients to that program. And that's the report on low-income energy assistance. The low-income household water assistance program. This program started December 1st of 2021, and it is a temporary program. It has continued longer than had been expected when it was initially implemented. Pitt County's allocation for 2022-2023 is $349,862. And you'll note on the report, we received in December a amount that was reallocated to us of $19,280. We asked for additional funds because a survey was done asking counties if they could use additional funds. We asked for additional funds, and this is the allocation that we received. So that is added to the initial allocation we had previously received. As of December 31st, we had approximately $57,000 left that had not been approved or issued. As of yesterday, we had $45,500 available. So just so clients will know that this is a temporary program. Once the funds are exhausted, the program will not continue. If there is another reallocation survey, we would certainly ask for additional funds for our citizens in Pitt County, but we're not guaranteed that there will be any additional money for this program. So if you have any questions, I'll be happy to answer them.
Any questions? Thank you, Brian.
Thank you.
Keisha Adams, come talk about CPS.
Good afternoon.
Afternoon.
So, let's see, I got a PowerPoint. Says, Peter West was here, so I'm not gonna go over all that he covered last month, but I will point out some of our past challenges, which included our backlog that we have worked very hard on and had brought that down significantly. Some of our other challenges include lack of staff, hiring qualified staff, and staff retention. So some strategies, because our theme for this year in CPS is back to basics, because we know that we aren't getting social workers that have experience in child welfare. So we realize we need to go back to basics. And we're currently working with our current staff because we do have a lot of new staff. And like I said, they're new to child welfare. So our thing is to go back to basics to get them that foundation in CPS so that they can understand, so social work supervisors can provide the tools needed so that we can make the best decision for families. So some of our strategies to improve our practice is complete thorough assessments that address safety and risk by accurately completing tools that follow policy. Supervisory oversight as required by state policy, and training, because each social worker, when they first start, are supposed to have a certain required training within their first year, and all social workers are required to have 24 hours of continuing education every year. So some of the resources that we're utilizing to help us implement these strategies and improve our practice include Allies for Outcomes, and they are working with our social work supervisors as well as our social workers providing support. We're utilizing them for coaching, mentoring, and guidance. Oop, I went too fast. I'll go back. Can I go back? I don't see the back arrow. It's a little, you gotta touch it very lightly because it speeds fast. Go back one more. Right there. So we have partnered with the state. It was a new initiative that they have implemented called RAMS, and it's a Regional Abuse and Medical Specialist. They're available 24 hours a day. Basically, they're on call. They're available during the day, they're available during the night, and when we get those cases that meet this special population, like it says, their overall goal is to provide guidance to child welfare workers in the management of high-risk child welfare cases that overlap with medical issues. So these are some of the populations and the categories that they assist with. Children under 3 that have sustained unexplained injuries, poorly explained injuries, complex medical issues, substance-affected infants, and children required by policy to have a CME. So they're at they're here for us, and we can call them, and we have to call them since we've decided to be a part of this process. When the case comes in, we staff it with them before the worker goes out, and we staff it with them throughout the process. So we're one of a few counties in North Carolina that have joined in on this effort. So we're taking advantage of that. And then another part that we're focusing on is training. We have upcoming trainings that will be held specifically in Pitt County that include assessments, intake, and domestic violence. Intake will be held this month. Assessments will be held in February, and domestic violence training will be held in April. So those trainings will be hosted in Pitt County, so we get to have a number of social workers that are allowed to attend that training, since we're helping set up that process and facilitating that training. And then the state has also implemented what they call North Carolina practice standards, and some of the basic trainings that's included in NC Social Work Learn, their webinars. Each one is released every month. They have social work practice standards for the social work supervisors as well as the social workers. And basically, the categories are assessing, communicating, engaging, implementing, and planning. And all social work supervisors as well as all social workers are required to participate in these trainings. And then we also have some internal trainings that we're setting up, and we're getting state technical assistant with these trainings. So when I say back to basics, we're going back to basics. We're going to have training specifically designed to address and teach workers how to adequately and appropriately fill out the tools that we utilize in helping us make decisions so that we can make the right decisions when we're working with families, addressing safety, risk, and identifying their strengths as well as their needs. So these are the trainings that we're implementing that we're going to do basically throughout child welfare. Staffing and retention. So some of our retention strategies, we have a structured onboarding process that we're implementing to ensure that when workers get to Pitt County, they have an overview of what to expect, get to learn the agency so they know what the expectations are, even down to where things are located. Because we have several buildings, as we know. So we want them to know where the other buildings are located, how to access them, what programs are within that, in those other areas, all the way down to how to sign out a car, how to get in the building, and just other things that sometimes we don't think about that people get confused about and can get frustrated. So we have a structured onboarding process that we're working with our staff development specialists. And then we're removing hiring barriers. We've had a lot of barriers with hiring social workers, but those things we're working with our HR department for Pitt County, and we've eliminated some of those barriers so that we can get people and qualified staff in. And we're defining our processes. We start all the way from intake through admin duties to see what needs to be restructured, what things can be taken away from social workers that's considered an admin responsibility so that they can have the time that's needed to actually practice social work and work with the families. Because if we can get some of those things that are time consuming that don't necessarily have to be completed by a social worker in the hands of the person that can do it, then they can more adequately spend time in the homes with the families. So we're doing some restructuring around that. And we're making progress in filling vacancies. I can happily say, and I'm quite sure all our staff would agree, we have staffed our on-call unit. Because as you know, DSS never closes. We are open 24/7, 365, 366 on a leap year, holidays, emergency closing. So I like to say that the on-call unit is the agency when the agency is closed. And we are fully staffed. We have 4 on-call workers. We have 3 that are currently up and running. We have 1 that's a new hire, so we had to get her trained. So for the most part, our daytime staff have come off of the on-call schedule. The plan is to have them fully off the schedule by mid-February. So that way, that can be an issue for staff, just feeling like they're working around the clock and don't have that relief. We have 3 new employees set to start, 2 in January, 1 in February. We currently have 2 vacancies in our assessment unit, as well as 1 supervisor vacancy. We have 3 part-time workers currently, and we do explore contract workers. So them are some of the things that we're making progress on.
Keisha, if I can just, I think one of the good things that has come out of us working with an agency with some contract workers is that they've actually worked for us and then have decided to come here to work. So we've actually been able to hire some of those folks.
Good. Yep. All right, so I'm gonna give y'all some data. So these are our intake reports. Screen outs are in orange, screenings are in green. So for the month of January, so far, we've screened in 25 reports. What's the date? 10th? So we've screened in 25 reports. We've screened out 18. December, we screened in 82. We screened out 59. November, we had 100. We screened out 57. October, we screened in 129, and we screened out
Okay.
36. Excuse me?
I hate to stop you. When you say screen out,
That means.
what is
it-
the terminology for that so that
Okay, so
the public
screen,
and I will know?
okay, screening means the report met the definition for us to be involved. It met the definition of screening in for abuse, neglect, or dependency. Screen out, it didn't meet the criteria.
Didn't meet the criteria.
Right, for us to be
Okay,
involved.
and while you're talking, could you tell me what CME is? I know what CPS is, but
Child medical exam.
child medical, okay.
Mhm.
Thank you.
No
And how
problem.
about putting your mic down so it'll pick up straight on? There you go. Thank
Okay.
you. Appreciate that.
Thank you. So for October, we screened in 129 reports. We screened out 36. And for September, there were 121 reports, and we screened out 45.
May
Oh.
I ask you a question?
Yes, ma'am.
Was those numbers on this chart in any place?
What, when you say any place, what are you referring
Screened
to?
in 125 and, when you gave the data,
Okay,
because we want to share our data with the public, and I was looking for the numbers on the chart. So I'd like to suggest that perhaps, because we're sharing not only with us as a board, let's make it easy for the public as well.
okay, no
Thank
problem.
you.
And open assessments, we currently have 277 open assessments. And for the first time that I'm aware of, our internal data and our state data is matching. So the number of reports that we have open is what the state data is reporting we have open. So that's a huge
Should we
accomplishment.
applaud?
Yes, you should. Matter of fact, we should get a standing ovation.
Standing ovation, okay.
Okay.
Or we could just wave our hands.
Yeah. All right, so some of our goals for CPS, just looking at our data, and this is gonna come later, but I'll throw this out here. We know we need more staff in assessments in order for us to adequately assess cases. Based on our preliminary data, we know we have a deficit in this area. So we would like to have a forensic and RAMS team, which specializes in handling those intense cases of abuse and those cases that meet that RAMS criteria. Our goal is to see a reduction in maltreatment rates, continuity of protective service, reduction in turnover rate, adequate staffing, and community education and engagement. Because if we can get out there and educate, then we don't necessarily have to substantiate.
Question. Oh, you're not burning you up today, huh? On the website, I haven't looked at it in a while. What do you have on the website that would encourage people to apply to help you meet these goals?
When you say apply, are you talking about people that's coming in or just the community in general as far as
Well, see,
education?
that's advertising.
Say that, repeat that,
You're
please.
recruiting,
Right,
that's advertising.
right.
What you say about, what we say about ourselves, help us to recruit.
That
And
is
we
true.
I don't want to see you scuffling for good hirees.
And we've had this conversation and recognized that there's some things that we need to do differently as an agency as far as community engagement, education, and advertising in the way that we seek out new social workers. So we're having that discussion, and we're working towards addressing that.
What is the rate of your retention staff? Are they leaving? Are they coming? Are they sitting still? Are they happy? Are they smiling when I look at them out here in the audience, when they greet or whatever?
When I came into child welfare, I was told basically that there was a 2-year, usually workers last about 2 years before they retire from child welfare because of the things that you see, the things that you see, and if you don't have a self-care plan for yourself to help you work through some of the trauma that we're exposed to as workers. And then when you look at the staffing deficiency, because things aren't like they were 10, 20 years ago. We don't just get dirty houses, children with lice. We're seeing more cases with mental health issues, substance abuse issues, not just, marijuana, but marijuana is an issue as far as substance-affected infants that people don't necessarily, marijuana has become illegal in other states, but it's not legal in North Carolina. So if a child is born positive for marijuana, then they're a substance-affected infant. And we're going to be notified, and we have to do an assessment. But then there are other drugs that's affecting, meth, cocaine. People are using fentanyl at a higher rate because sometimes they're addicted to opiates because of medical reasons or whatever other reasons, and they start looking for drugs that cost less. And so that's why over the years we've seen an increase in drug activity and the types of substances people are using. So sometimes we get trifectas. So those type of things are affecting how social workers get in. They can't just get in and get out because there's so many dynamics and family dynamics going on within the cases that it's not as simple to just get in and get out, and you have to work and dig deep and not just scratch the surface, but we got to start seeking and looking at those underlying issues, and that takes time.
How long have you been with the department?
I've been with Pitt County for 16 years. I was at Edgecombe County prior to that.
All in CPS?
All in CPS. I was an investigator when I graduated. I was on call for about 6-7 years and worked my way up, supervisor, now program manager.
Well, I think it will be good for when we are making positive strides and gains, and we have this marvelous thing you call technology and website and things. People do look at us, and the reason I'm bringing this up, I bumped into a young lady. I won't call her name because you're not interested in that. What she said was, I just moved to Pitt County from Florida. And I says, how long have you been here? And she said, 2 months. I said, so how do you feel about Pitt County? She said, I love it. But right now, she had one of her family members in a wheelchair, and she was having problems finding the resource that she was searching for in Pitt County. So when people arrive here new, whatever you can put out on the website or make it simple and convenient as to where they can offer it. Because unfortunately, we have, they call it 2 social services. And it's not really but 1 social service here, but there are different activities and programs offered in the 2 different places. And I don't know how to look at it, but
That's something we can work with our
All
public
right.
information office to look at how we can put information for people when they need to
Do you have
determine.
that?
Yeah.
in the,
So, Miss Mary, just to talk a little bit about that. So, I just can remember at my interview for this position that, I heard that Pitt County is very rich in resources. And so what my goal is for this coming year and hopefully months is starting to meet with different agencies that offer services, all kinds of services. Work with the United Way. I know they have a resource guide, but I don't know that I'm still in the investigation part of all of this, but looking to see how we can do two things. Get our resource guide together for folks to be able to find that help if they need it, but then also how do we do some cross-systems work? I think oftentimes people look to the Department of Social Services, not just here in Pitt County, but anywhere, that we are the answer to all of the issues at hand. And while there are many things that we do help with, I also think there's also many community folks that could help us help them. And so how do we work better together? And those are some of the things I want to, do going forward is getting that. So getting that resource guide together, having it comprehensive, as well as when one of our folks needs something and maybe it isn't something that we provide, who could we look to be able to do that? And I know this is probably an expression you've heard before, but no wrong door. Maybe we can't do this for you, but we know someone that can, and so
Yes,
that people aren't
absolutely.
turned away. So that's really what my goal is going forward. I also want to be able to change our reputation to be looked at as a helping agency, and that we are collaborative with our partners as well as with our families. And how do we change our reputation in the county? How do we start being more preventive in nature rather than waiting for those
Something
child
to
protective
happen.
cases to come in? How do we get out there? How do we become a mobile and agile workforce where we can be, whether it's working with people in rural poverty or urban poverty, how do we meet the needs of all of our people that live here in Pitt County? That's what I want to strive for. And it's getting the things in place now, getting us our staffing where it needs to be, and then start moving forward with some of these ideas.
Well, you will be amazed to know that people who've lived here for eons, is that a word? They don't know either, and you're just getting here. But what I'd like very much to see, because this is a very needed service
And we
that
do
we
have,
provide the citizen. And a lot of times, the social service gambit is so large until you really don't know where to look.
Right.
And I'm saying that to not talk about the staff in a negative way
No.
and whatever, but I bump into people who are just coming here. And when you look at what's happening in society, people are moving. The people in California are not used to the floods. We do. So when people make those family life changes, we need to be ready to have something. And I like that what you said, the manual, the whatever. the
Resource guide.
Yeah, that sounds good
and
to
I'm
me.
glad to hear you say about people moving into Pitt County, because I think Pitt County, the population exploded at some point, and I don't know if we necessarily kept up with the explosion. So,
It took me, I usually could come I live up just across the river there on the northern side. And usually when I leave home, it takes me 15 minutes to get here, depending on what time of the day it is. I left home one day and thought it would only take 15 minutes, and I don't want to bore you all, but when you have to wait for 2 lights to change at 5th Street, and you leaving at the same time, I said, where did all these people come from? So that means that we're going to have to step up our game.
that's right.
And we're going to have to be cognizant of the needs of people when they don't know where to go. And then the frustration comes because I'm hearing different things when I go to national meetings and state meetings, and our neighbor are selling marijuana legally. So we're going to be impacted because Pitt County is the county that people come to for commercial services in this area and region. So I'm not trying to say that, but I'm just trying to say that we're going to have to start looking at things differently.
Absolutely, and I think during one of my managers' meetings, it was said very succinctly, and the Department of Social Services has not grown in comparison to the growth of the county. So, that's something that we need to look at going forward, absolutely.
I can tell you that is the truth. You can see people sitting on the ground in the rural area, and there are no homes. And mobile homes are falling apart and they're trying to live in it. And so if you have a mobile home and the front has electric and the back where the children, there's no electric, no water, anything else. And we have to look at how we change things and address so that our taxpayers can be safe. And our taxpayers can feel good about the quality of life. I haven't had a sermon in a long time. Every now and then I get, but I'm a little full today. And so I
That's okay.
appreciate all of y'all's patience.
Thank you, Miss Mary. We have another question.
My
from
question
Dr.
is about
Bunch.
training, and I would be interested in that. And so I'm very excited about the training that the workers will receive.
Right.
So the first question is that the training, is that in addition to or in lieu of what we used to call pre-service training offered by the state?
So in order for anyone to touch a case in child welfare, they have to have pre-service training.
Okay,
So this is an addition to.
okay.
So NC Social Work Learn is where we go to register for training and see what the state offers, because the state offers trainings. So each area, whether it's assessment, in-home, or permanency planning, has specific training geared towards those specific areas. So for assessments, we do intake, investigative assessments, completing safety assessments, just doing an overall assessment. And then there's other trainings, but those are the two basics. So, and in those trainings, you get an overview, but it's not necessary, because they don't necessarily have the time to drill down and put a great deal of information into how to adequately and appropriately fill out the forms. So that's what we're going to do.
Okay.
We've engaged with our RC regional consultant that's here working with us, and she's going to assist us, and we're going to work together and provide some internal trainings to touch base on the actual form so that workers have a clear understanding of how, I like to say, the sum is the total of its parts. So if you got the safety assessment, the risk assessment, the strengths and needs, all of that works together when you're making a decision so that they can understand how one impacts the other and that they don't work separately. So we're going to get into that, to the weeds.
To the weeds. Wonderful. And my other question is about Allies for Outcome and RAMS.
Okay.
So these organizations, are they free for us to use, or is there a cost to the agency?
Allies for Outcomes is a consultant company, so there is a cost to the agency.
Okay.
RAMS is free because it's provided by the state.
Okay. All right.
And it's a new program that they're implementing, and we're one of the pilot counties that have joined in on that pilot.
Oh, wonderful. Thank you.
Are there any programs at Pitt Community College that assist this agency with upgraded training now? And I ask that because since you're new, Ms. Rochelle, there was a program that we funded or whatever we did with Pitt Community where you could get some training And I'm thinking Brian would know some of this and some of
Right.
these other people. And as we look at budgets and whatever, because I'm already looking at, in my mind, how people are going to be coming in asking for funds. I'd like to know the statistics as it relates to the program that come out of that effort we did with Pitt Community College. And then I'd like to also know what they offer that can assist us with training people in that. And you don't have to do it today, but I'd like very much to see it come back. Because she may not know about that, and because we were there when they funded. So you want to hit the public?
Yeah, I would just add that that program is specifically for the income maintenance caseworker positions in the public assistance programs, and there are 2 courses that teach how the actual NC Fast Case Management System is used in processing cases, and we have hired employees as caseworkers that have gone through and have completed those courses. So we're still getting applications from individuals who have completed those courses, and some that are coming in the next couple of months have actually completed the courses. So that has been helpful. It's sort of somebody that's interested in working as an income maintenance caseworker in the public assistance programs. It gives them an exploration and training to see if it's something that they are interested in doing before they even get here.
Do you recruit in that course? Do you recruit in that course, and have you gone there for recruitment? Was one
Well,
question.
they are aware of our postings when we have positions, and they do encourage the students in those classes to apply with us and other counties. And it's not only offered at
But
Pitt
we are
Community
not
College.
aggressive as going over there.
Well, we've not been there recently, no, that's true. But we have, one of our employees was featured in the Pitt Community College magazine, and I'll try to find that if I can get that. If you'd like to see that, would share it with y'all.
I just want us to get the
Well,
best person
But
out there.
but it would be something nice to see, because they highlighted her. She was one of their students, and she has been hired here. It sort of shows from where she started to where she is now.
Thank you so very much.
Okay, thank you.
So I guess my 5 minutes are up. So
Oh,
what I will
thank
say
you, ma'am.
is,
I am so pleased that we have someone that knows about that, Miss Adams.
so our upcoming events include Social Worker Appreciation Month in March and Child Abuse Prevention Month in April. All right?
Thank you so very much.
Thank you so much.
Thank you, Keisha.
Okay, holiday cheer final update. Chandra Mewburn.
Good afternoon.
Good afternoon.
Good afternoon.
Holiday cheer was very successful this year, and we had numerous community partners. I asked a few of our community partners to be here with us today so I can introduce them. My hope is during some of the board meetings, if allowed, that I'll be able to bring other partners to introduce them, as they help us out not only at Christmas, but at other times during the year. Due to our partners, we were able to provide holiday cheer to assessments, in-home, and permanency planning unit. We can't emphasize enough how important our community partners are, and our agency thanks you for your service. So today we have with us Mr. David Dupree and his wife, Miss Evelyn Dupree. Mr. Dupree is the president of the Woodman Life, and Mrs. Dupree, I'm
I
sorry,
think we have a camera over there.
you want us this way?
someplace. Is that right? Some of this, thank you, ma'am. Appreciate that.
Thank you.
I would like, they came, and so we want them to appear on this technology here.
Okay.
And that's a way of thanking and publicizing the good that you do for the citizens of Pitt County. Thank you so much for your cooperation. Then I get to see you, Luca.
Okay, so this is Mr. David Dupree and his wife, Miss Evelyn Dupree. Mr. Dupree is the president of the Woodman Life, and Mrs. Dupree is the treasurer. We have Dr., raise your hand, Christina S., step up. She was with ECU
back.
and the Brody School of Medicine, and she works with the Project ELF organization that helps us. Then we have y'all step up, the I Still Do Life Group with Cornelia Christian Center here in Greenville. So if anybody in this group just wants to tell your little experience with working with us in holiday cheer, you can take just a few seconds to do that,
Absolutely.
please.
I guess I'll do it. So my husband and I actually facilitate the life group I Still Do through our church. And every semester that we have the life group, we do something called like Ultimate Reach as a way to get back in the community. So for Christmas, we decided to do kind of like the wish list for one of the foster children. So there were five couples in our group. So each of the couples purchased gift cards for one of the foster children as a way to give back.
Excellent. I also would like to let you know, board members, fellow colleagues, I'm glad that you were here. Koinonia, right across the river, north of the river, very seldom do you see congregations come north of the Tar River. But Koinonia has been visible on ours, and the reason I'm pointing this out because my district is 233 square miles plus, and it is one of the poorest districts on the Pitt County Board of Commissioners. And Koinonia has been over there with a visible presence twice at a very popular corner in our community. I'd like to thank you and your staff and your pastor and your church and administrative leadership for the tennis shoes and everything else you've done. I commend you for assisting because you have met some needs.
And can I just add with the I Still Do Life group, not only do they provide gifts for that teenager, they also have taken up the charge to being a support and mentor for this young lady when she's in need. So our agency thanks them for that as well.
Thank you very much.
Thank you.
I would like to say that our main focus is community involvement. We contribute to the soup kitchens, homeless shelters, fighting hunger initiatives, children's homes. We have one in Middlesex, and we have one in Kinston, the Kennedy home that we support every year. Center for Family Violence Prevention, we've supported them. Food Bank of Central and Eastern North Carolina. Our veterans. Which I am one of.
Oh, thank you for your service.
And I also worked for Pitt County for about 15 years as in education. So
Wonderful.
we do a lot in the community that seen and unseen, very likely. It's one of the things that I've involved myself with since I left the military that I truly, truly enjoy doing as well as I did in the teaching profession. I just thoroughly loved it. But we do a lot in the community. We do disaster relief, hurricanes, floods, anything, just about anything that meets our needs. And our animal shelter, we do dogs too. And this year, our little Greenville chapter, I think we contributed close to $7,000 in funds towards community outreach. And it's something we're proud of. And we also sell insurance. I'm not a salesman, but I can get you in touch with them.
I'd like to thank all of you as community partners for this agency, and you certainly need it. We don't have enough dollars to meet all the services, and every little bit helped. And as you noticed, there was vacancies and a problem finding staff. What you do does not require a degree, only love and constant care. And I thank all of you for what you do. Thank you.
Thank you.
I'm going to just be brief, but I've been a pediatrician here in Pitt County for 15 years. I work at ECU Pediatrics and have had a lot of opportunities to work with DSS, but not in a way that's as meaningful as this outreach and this project has been. So I was watching the slides from the earlier presenter, and I was looking at the slide, and I leaned over and told one of Chandra's staff that it looked like my office. You know, we have a lot of openings and turnover and all these things, but in the course of doing this project with Chandra and her staff, I've just never felt like they were stressed or didn't want to help us help them. So it was just a wonderful partnership that I was very thankful to be a part of. It's my third year helping them, and I think I just want to end by saying that just this work with them during the holiday season just is so inspiring to me and wants me to try to figure out ways to continue to help them and support them year-round, not just at the holidays. So I thank her and her staff. Where'd you go? Because they make it easy, and I know it's not an easy job. I mean, I work with a lot of these kids sometimes when we're working on them with cases, and it's a different perspective coming at it from another way. But I've been in meetings with her where her phone is just blowing up. I know everybody needs her in her time, but she was always willing to answer my questions, just making sure we got everything we needed for the families that needed things this year. So I thank her and her staff too. I think they deserve a huge round of applause.
Thank all of you so very much. All of you.
Thank you, and so alone we can do so little, but together we've done
A
so
whole
much.
lot.
Thank you.
Mhm.
Thank you.
Thank you. Okay, Ms. Rochelle, it's time for your director's report.
Whatever I have to say is not as meaningful as what we've just all heard, and it actually brings tears to my eyes that we have such wonderful people.
Yes.
And how do we move forward in doing more, not just at the holidays, but throughout the year. It's remarkable. Just to give you some brief updates, we started our Speak Right, which is the dictation system where the social workers can actually dictate their notes into the phone. They've extended our pilot period of time because it was over the holidays and not as many folks used it as could. So we're hoping that people will start using it regularly to see if it's something that we want to invest in going forward. We've been working on, and you've probably seen it in the news, where Greenville, the city of Greenville is, they were going to start to charge for parking at the beginning of the year, which hampers our ability to go, and we go to court 3 days depending on what the cases are, but our busy day is really on Thursday. So there would have been a problem with finding enough parking spaces for the attorneys, the paralegals, the social workers, and then of course people that had to go there because they had a case there. So we've worked that out a little bit. We're continuing to work that out.
Ms. Rochelle, I think the county has provided some free space.
10.
And so you probably need to talk with the offices over that way, that when you come up, you have a way of parking free. I couldn't know how to work the thing.
Well, I think they
And I wasn't the only one.
yeah. So I think they were looking at the app as a possibility, and now they've said they'll do some kiosks because not everybody's going to have a smartphone to be able to do that. So we're in a better place than we were a week ago, but I still think there's some work that needs to be done around that. So more to come. And so the gentleman that came and spoke with us from North Carolina Department of Health and Human Services at our last meeting, Peter West, his supervisor, which is Lisa Conley, who oversees all of child welfare and all of adult protective services would like to come next month and address the board about the work that we've been doing in Pitt County and celebrate with our staff for the wonderful progress that we've made. So I'm hoping that she'll be able to come. I think our next meeting is the 14th. And that she'll be able to come and she was actually one of the first people I met on my second day on the job. So I'm glad to have her back in a more positive light. So that's it for my updates.
You're to be commended that you not only came here, but you hit the job in a race car.
Absolutely.
Thank you.
So do we have any board member comments today?
I done said everything I need to say.
I'd just like to say Happy New Year. Thanks to the staff for all the positive updates and all the hard work in meeting or exceeding benchmarks. And so we look forward to continuous progress.
Anyone else?
Am I in order?
Yes, ma'am.
Madam
Sure.
Chairman, I'd like to see us adjourn.
Okay. May I have so we have a motion, can I have a
That's
second?
the motion.
Second.
All in favor?
Aye.
Aye. All righty, thank you.